The Greater Louisville Medical Society is proud to announce our commitment of $100,000 to help launch the Pulse of Surgery program. By visiting the Louisville Science Center and viewing live heart surgeries, middle school and high school students will learn about the causes of cardiovascular disease. And by interacting with physicians and the surgical team in the operating room, we are hoping to motivate them to pursue careers in medicine. What we need to do is we need to recruit the next generation of physicians. As you know, in Kentucky, we don't have enough doctors as it is. We have 4 million residents and not enough doctors, and that's expected to get worse. So we are excited about this as a way to motivate students to succeed in their classes in science and to become the physicians of the future. Part of our mission of the Greater Louisville Medical Society,
Pulse of Surgery is designed to recruit new minds to the medical profession and also turn these dismal health statistics around. Pulse of Surgery will allow middle and high school students from all around the region and the state to engage in unparalleled anatomy and physiology lessons through real-time connection to the people and activity in a hospital operating room. Through broadband technology, students and the surgical team will see and communicate with one another, along with a curriculum that emphasizes medical technologies and procedures. Surgeons will show how lifestyle choices and changes impact the heart and will discuss the educational paths that they follow to achieve their career goals. The program also includes a toolkit with real surgical instruments, journals to record thoughts and observations, supplementary visuals, interviews with physicians and other medical professionals, and pre- and post-visit classroom materials.
And thanks to the support of many donors to the Jewish Hospital and St. Mary's Foundation, the Jewish Hospital operating rooms will be newly equipped with video equipment and cameras that will allow us to have a live feed from the OR straight to the Science Center. Dr. Slaughter and his medical care team will be able to perform surgery live and answer questions that students might have that are watching. And it's a truly interactive healthcare that would not be possible without the support of our foundation.
The idea is, what could we do to help, prevent heart disease in Kentucky and improve the lives of teenagers and young adults as they sort of enter into what really is becoming a sort of complex world. It's a lot different for them. They have access to many things that we didn't. Certainly the forms of entertainment have changed. And this has resulted in significant health problems for them, as Dr. Allenbaum alluded to. So there really were sort of 2 main goals for this. So one is a primary goal, and that is to try and help improve the overall health of the youth of Kentucky, to teach them good, healthy habits, and to hopefully prevent cardiovascular disease. Because still in the United States, cardiovascular disease is the #1 killer in adults. And unfortunately, it starts when they're young. The other sort of startling statistic, I think, to add to it, that Dr. Allenbaum has already brought up, is that for the majority of kids, that by the time they reach 18 years of age, less than a third will exercise for 20 minutes twice a week. And this is, combined with their dietary habits and whatnot, is a huge problem. So part of the advantage of this program is, to read about it in books is one thing, but to see something live, to actually see a beating heart, to ask questions, has a much greater impact. It's very important that it's safe, which has been proven before, but it has a significant impact, and we hope to be able to measure that by going back and then testing the children, sending out questionnaire surveys, and looking for lifestyle changes that may have a significant impact, not only for the health of those children, but for the overall economic viability for the state of Kentucky. And then secondly, is that there's always need for talent in the healthcare field, not only amongst physicians, but also for nurses, physicians' assistants, nurse anesthetists, but the whole slew. And it's a national problem. And the problem is many kids and teenagers think that it's not an achievable goal. And when they have an opportunity to spend 45 minutes or an hour to ask questions directly in an environment where they're not uncomfortable, where they can ask things without being embarrassed, they realized that everyone in the room was just like them, and that no one was special. They just worked hard. They decided it was something they wanted to do, and it is achievable. So it provides a significant impact to give them a boost in the ability to realize that this is a dream or a vocation that they could also achieve.